Hi, Dr. William. Here we are 6 weeks after surgery with this patient, and she's been nice enough to let us film. And I just wanted to explain what we did here, and that is we removed her breast implants. They were too big for her, and she was saying to me that she had quite a bit of pain from them, and she's now 6 weeks out from removing the implants, and then we did a lift. I love breast implants. I use them all the time, and there's very, very happy patients with breast implants. They are excellent, but they're not for everyone. And so I do spend a long time telling patients who have very big breasts, or if they have very wide breasts, that they're not necessarily the best candidate for a breast implant. So she is probably someone, if I had seen her a long time ago when she had her original breast implants, then I probably would have said, we could do a pretty good job without using an implant. You don't have to use an implant. But she ended up having an implant, and then they just were hurting her and bothering her and too heavy, and they didn't look as good as she liked them. So we just removed the implant. Now, why could I remove the implant and do a lift in her when some people, I need an implant? And it all comes down to volume. So if you have enough volume in your breast, then we can do a lift and we can get a nice shape. That's what she has now. We removed the implant, and she just has nice fullness. She still has good cleavage, nice fullness, and a nice shape to her breast, because this is just all her own breast tissue. There's no implant in here. And that's kind of how we made the determination when I originally saw her. I can sort of feel as to what is breast tissue and what is the implant. And I said to her, I think we can just remove your implant. You have enough of your own breast tissue that I can work with to be able to recreate the shape. So she's thrilled now. She was just telling me that she's had 2 menstrual cycles, and that's when she used to have a lot of pain, breast pain, and she's had 2 and she doesn't have any. So that for her, that's the best part of having her operation, is she's pain-free. We don't always operate for pain. That's not a very common thing, but sometimes that the implants are bothering patients for reasons we don't always understand. She had a little bit rough capsules in there, and I think that was probably the problem in her situation, but she's certainly feeling better. She looks better, and I think overall, her breasts are more proportionate with her body. They're not as heavy, and they're kind of not really an issue anymore. She's just living her life and enjoying herself, and just has some good cleavage and nice shape.